A 6-year-old boy is evaluated at an urgent care for skin abnormalities and refuses to bear weight on the left leg. He also has very slow wound healing after bumps and scrapes. The patient's family has suffered from inadequate food intake for the past year. Patient physical examination reveals bleeding, inflamed gums, abnormal coiled hairs, petechiae in the chest and back, and diffusely tender muscles. Laboratory studies show a hemoglobin level of 10.2 grams per deciliter. Which of the following is most impaired in this patient's most likely condition? So go ahead and pause the video and try the question yourself before we go into the solution. Here we're zoomed in on a fibroblast, which are cells that make collagen. Other cells that can make collagen include osteoblasts and chondroblasts. Here we're looking at the rough endoplasmic reticulum, and all the steps that are with these dashed lines are occurring in the rough endoplasmic reticulum. The very first step is that the pro-alpha collagen chain, or pre-pro collagen, is formed, which has the primary amino acid sequence glycine XY, where X and Y are either proline or lysine. The second step is hydroxylation of proline or lysine, which requires the cofactor vitamin C. And patients who have a defect in vitamin C are unable to hydroxylate pro-alpha collagen and have a problem synthesizing collagen. The third step is glycosylation of the hydroxylated pro-collagen chain, and after this, pro-collagen can be formed with a triple helix structure. After pro-collagen is formed, it is transferred to the Golgi apparatus and exocytosed, which ultimately leads the pro-collagen to enter the extracellular space. Then an enzyme called pro-collagen peptidase cleaves the C and N terminals of collagen, and after this, lysyl oxidase will cross-link collagen to create mature collagen fibers. And a deficiency in lysyl oxidase will cause Menkes disease or Ehlers-Danlos syndrome, whereas a defect in pro-collagen cleavage from pro-collagen peptidase can cause Ehlers-Danlos syndrome. So going back to the vignette, here we have a young boy who is being evaluated for skin abnormalities and refuses to bear weight on the left leg. Additionally, he has slow wound healing after bumps and scrapes. Patient's family has suffered from inadequate food intake for the past years, and he reveals heavy bleeding, inflamed gums, coiled hair, petechiae on the chest and back, and diffusely tender muscles. Additionally, the patient is anemic. So this patient, given the history of inadequate diet, as well as the other physical exam findings, support a diagnosis of scurvy. And scurvy is a problem with the hydroxylation of pro-alpha collagen. So this is a problem with collagen synthesis, and it's because you don't have vitamin C to serve as a cofactor for the second step in collagen synthesis in the rough endoplasmic reticulum of chondroblasts, osteoblasts, or fibroblasts. A is incorrect because carboxylation of glutamic acid would be defective in a vitamin K deficiency, and since vitamin K is produced by the gut microbiome, and there's no evidence of, say, recent antibiotic use, this answer is unlikely. Factor VIII synthesis. This is the cause of hemophilia A, and a problem producing one of the factors involved in secondary hemostasis, and this would not explain certain physical exam findings, such as this would not explain the history of the inadequate food intake, as patients who have a defect in factor VIII would likely present earlier in life, and it would not happen after inadequate food intake. Protection of fatty acids from free radical damage. So patients who have a problem with protecting fatty acids from free radical damage, this is consistent with a vitamin E deficiency, and vitamin E is important in protecting red blood cells as well as the phospholipid membrane. And these patients would have neurological conditions, which isn't really consistent with the presentation we see here. Rhodopsin and iodopsin synthesis. So these are proteins that are found in the eye, the back of the eye, the retina, and you would expect this to be defective if the patient has a vitamin A deficiency, so they would experience visual defects, which isn't really consistent with the picture that we see.